good. All right, perfect. Thank you. Okay, so welcome everybody. Like I had mentioned earlier, my name is Dr. Michele Marr, and I am an assistant professor here at California State University in Los Angeles. And our presentation is on the neurobiology of addiction and focusing on the mind and body connection. And then I'll have my colleagues go ahead and introduce themselves.
Hi, everyone. I'm Dr. Paul Maddox. I'm a licensed professional counselor and a counselor educator at the University of Wyoming, and I'm excited to be able to be here and present to you all today.
Good morning, everyone. My name is Juan Sanabria. I'm currently in my second year of graduate school here at Cal State University, Los Angeles. I'm a Marine Corps combat veteran, served in Fallujah and Ramadi, Iraq during Operations Iraqi Freedom and Enduring Freedom. Just celebrated 5 years of sobriety, and it's an honor to be here with you guys, so thank you.
Excellent. Okay, and then a little bit just about a couple of minutes about our background. So again, as I noted earlier, my name is Michele Marr. I am an assistant professor in rehabilitation, psychology, and counseling. So my background is really focused on, my research is focused on substance abuse and addiction within the rehabilitation, counseling, and psychology discipline. And so that has brought me into presenting here today.
Yeah, and similarly, I'm assistant professor in counselor education. As a licensed professional counselor, I do a lot of work with clients in addiction, and I research both addiction and trauma and play-based approaches in working with children and families. So.
Much like my colleagues, I'm actually working towards earning my LPCC, so working on finishing up graduate school. And my fervor lies in the endeavors of assisting individuals with a particular focus on the veteran community that are working and dealing with trauma-related challenges, substance abuse disorders, and addictive behaviors.
Okay, a brief overview of what our presentation will be with you today. Today we're going to talk a little bit about what is neurobiology, some definitions about what is addiction, and then really combining them and think about how are they connected. And so that kind of goes back to the title of our presentation, the mind and body connection. Then we will have a few slides and some information to provide to you regarding related research, so current research, a little bit on past research, and then finally we'll wrap it up with some strategies and implications for practice. So we always like to think about the research that we're doing, but then also putting that into action. So how can we practice what we're learning for our students, for our clinicians, for our clients in general? So that's an overview.
And recognizing the limited time that we have for our presentation today, we're going to do our best to go through some specific learning objectives and some takeaways for you. So as Michele was describing, we're going to be reviewing the neurobiology of addiction, including those reward pathways and the roles of neurotransmitters, how addiction affects brain function overall and the processes for that. We're going to be examining that connection between addiction and the mind-body systems that are in play, including the impact of stress and trauma on addiction and the importance of mindfulness-based interventions, as well as exploring the recent research on addiction and that mind-body connection, how it manifests itself in our behaviors and in our bodies, including the potential factors related to addiction and the use of neuroscience-based treatments. And then finally, we hope to wrap up with by identifying some strategies for interdisciplinary collaboration and integration of evidence-based and mind-body approaches into addiction treatment. So hopefully we'll be able to get through all that in the next 10 or 15 minutes. We will do our best, and if you have any questions towards the end, feel free to let us know as we go through some of this.
Thank you, Paul. Okay, so just some common terminology and verbiage that is often used within the addiction field. So neuroplasticity, so it's the brain's ability to change, remodel, and reorganize for purpose of better ability to adapt to new situations. So neuroplasticity is an amazing thing. It definitely has evolved and helped our medical field, rehabilitation, addiction, neuroscience evolve and grow in a really positive way. So that's something that we'll be talking about a little bit later. Neurobiology itself is the biological components of the nervous system and the study of the brain and the nervous system. So really just looking at, okay, as we noted earlier, we have a lot happening in our body physically, but then how does that connect to our nervous system, but also to the brain? So then thinking about mental health, diagnosis, substance abuse, and addiction. Leading us into addiction, which is a chronic relapsing condition involving complex neurobiological and environmental interactions and the use of substances or engagement of processes / behaviors characterized by compulsive actions and or substance use despite adverse consequences. So we all kind of struggled a little bit about this definition because there's just so many definitions out there about what is addiction, and it continues to grow. One thing that we wanted to note here is that we are talking very much on substance use and addiction in general, but thinking about there's also the process addictions that we didn't get into too much in this presentation. That's like another presentation, but let's just kind of keep in the back of our mind that addiction is not limited to only a substance use or ingesting a drug of choice. And then lastly, dopamine, which is a term that we all have heard, hopefully, and it's a naturally occurring compound found in the body that serves as a neurotransmitter and is involved in the brain reward activity. So we're going to talk a lot about that in a couple slides, but just kind of wanted to lay down some of the foundation terms that we will be using for the next 15 minutes. So the research has evolved to include the study of brain alteration. So thinking about, again, in the past, maybe I'd say like 20 years ago, we were very focused on the medical model, the moral model, and we've evolved such as the human service profession and the medical profession, thinking about substance use in a very different way. So thinking about how is the brain altered for individuals that begin to use substances. And we know that it is a brain altercation. So that's something that research has supported and moving forward in the neuroscience, neurobiology field. Then we're thinking about the chronic administration alterations. So one thing that the research really has focused on is thinking about the decrease in the relapse threshold. So what we see, or what research has supported, is that individuals, when we look at brain imaging and brain scans, those that are using substances, their brain is going to look very different in not a positive way compared to a so-called normal brain, or a brain that is not using substances. So that's something that has really catapulted and facilitated. Let's look more about brain activity and what is happening in the brain when an individual uses substances. And that also leads to the decrease in the relapse threshold. So then also thinking about molecular genetic studies, as noted earlier, even in the previous presentation, we're really thinking about like epidemiology, genetics, and what that looks like too in relation to the brain. Then also in the research, there's been a fundamental push towards the stages of the brain reward pathway. And again, my colleague Juan and Paul will talk a little bit more about this in the future, but thinking about really there's 3 stages. So thinking about the binge and intoxication stage. So what happens there in the brain, this is very important, is that there's changes in dopamine, which also leads to opioid peptide change. So that's the alterations in the brain activity when someone's beginning to become intoxicated and then they binge. The next stage is the withdrawal or negative affect. So thinking about after they ingest or are intoxicated, then they have to withdraw. So the negative. So then it goes, it's very much an emotional roller coaster, but it's all coming from the brain activity. So now we're thinking about there's a negative emotional state that increases. And so that's where moving forward into the mental health area, It's dysphoric and stress-like responses. So thinking about a decrease in dopamine leads to stress neurotransmitters. So all of a sudden, an individual has this really high with the dopamine, it's going up, and then you take that away, and now we're crashing, and now we're feeling like stress, which again produces more stress neurotransmitters. And then lastly, the preoccupation anticipation stage. So now that they're feeling really low, there's low dopamine, my opioid peptides are at a lower level. Now I'm thinking, okay, I want that feeling again. Now we're into cravings. So now when you start to crave and you're thinking about, I want to use again, I need this to feel good, that dopamine high, there's a decrease in executive functioning. Very, very important with our clients, because that is, again, coming back to our brain, thinking about making decisions. The prefrontal cortex is where everything really happens within the brain. Not everything, but a majority of things are happening in the brain. And so we're thinking about, okay, now my prefrontal cortex has been altered, and so I'm not going to make the same decisions that I would even if I'm not using at that moment. But if I am craving, that impacts that function of the brain. And then also the basal ganglia, that's also affected, and then insula as well.
Thank you, Dr. Marr. So basically what we have here is our visual representation that we created off of, to give you a picture of what Dr. Marr was referring to when we talk about the brain's reward pathway. It literally shows you how addiction affects and influences the brain, keeping in mind that the reward pathway in the brain is a very sensitive, delicate, fine-tuned machine that runs on its own. Any sort of influence can dramatically and drastically throw off the timing of that fine-tuned machine. So we can see here during the binge intoxication stage that it's substances that influence those changes and affect neurotransmitters such as dopamine that results in altered moods or feelings. You move on to the withdrawal or negative affect stage, where we're able to see that as a result of lower dopamine levels, once you come off that high, the brain enters, much like Dr. Marr mentioned, a stress-like response, and that's resulting in a negative state, not only for the mind but the body. Then we enter the preoccupation anticipation stage, much like Dr. Marr mentioned. This is where we have increased cravings, where the mind is looking to increase those dopamine levels. And this tends to result in risky or less favorable behaviors and actions in order to achieve that elevated level. Next slide.
Yeah, and I do want to point out that this graphic, you may have seen some similar ones in some of the previous literature. We tried to combine several things together to present this in a more straightforward way. But basically, this is what we're getting to with this. So go ahead,
Right.
Juan.
So with all that information, what does it all mean, right? Like, what are we doing with this information I'm presenting? In simple terms, basically what we're stating and letting you know is that substances have essentially hijacked the brain's delicate reward pathway, and they've significantly increased dopamine levels. As we've mentioned, dopamine is a powerful neurotransmitter as well as modulator. It's crucial in both learning and motivation, and Dr. Maddox will elaborate more on this on the next slide. But what is that impact? As an addict, I can personally attest to how powerful and controlling these urges and desires can be within your body. When your brain is fixated on increasing those dopamine levels to be where it was at and get those feelings, the withdrawal is very powerful, and the cravings and stress is very real. So what do we do about it? Well, collectively, we're going to offer some suggestions in a later slide, but one of the main suggestions is to increase one's awareness on what to do when these desires and cravings hit. It's called becoming self-aware, but we'll talk about that in a later slide.
Yeah, and with this too, I know Juan and Michelle and I, as we were putting this together, one of the things that we had several discussions on was that role that the dopamine does play, because a lot of people think dopamine just means happy. Oh, I feel happy about it. But in my experience of working with a wide range of clients and individuals, a lot of times it's not, oh, I'm happy about this. It's, I have this yearning, I have this desire. I don't want to do this on a cognitive level, but on a physical and an emotional, visceral level, I have this desire and yearning for this, and that dopamine creates that desire with that. And so I think that's something to keep in mind too, as we explore what to do, is we're really addressing desire more than we are whether or not someone's happy or even feeling good, more than anything else. Now, as far as related research to some of this, again, dopamine is a key component to the addiction process because it drives that need and that desire to use. And research has demonstrated that substances such as nicotine, cocaine, amphetamines, opioids, and others, they can activate and affect the mesolimbic dopamine system. And so, as Michele was talking earlier, when we start using certain substances, or even if we're engaging in certain process types of addictions, that increases dopamine levels, or it can create or introduce a synthetic chemical version that the brain takes in similar to dopamine. And so it's flooding our brain with those chemicals. And so that impairs and impacts how our executive functioning in the prefrontal cortex. However, the way it's doing that is in some ways kind of short-circuiting how we operate, and it's going through that limbic system, that mesolimbic system. And so one way to think about this too, if you're familiar with some of the research and things on trauma work, the limbic system is where a lot of our connection with others and emotional regulation and things, that goes through the limbic system, whereas our impulse control, higher order thinking and things are in our prefrontal cortex. So if we're going to be intervening, we need to intervene at that connection and that emotional level, in addition to trying to provide information. And one thing I talk about is, while we can provide teaching and information and sometimes skills, what we're really trying to do is provide ways of increasing connection and awareness. Because what I was saying is, before I froze, hopefully, if we're going to be intervening, we need to intervene at that connection type of level through that mesolimbic system to help address that regulation in the dopamine. And so how do we do that? Well, research is showing the use of functional neuroimaging, or fMRIs, that they can be used to examine neural circuits that are involved in addiction, and looking at that reward and inhibitory control and stress and emotional processing, as well as how the learning and memory.
Okay. Well, Juan, do you want to keep moving forward, you think?
Yeah, that's fine. Basically, an fMRI can provide some video, like you can actually see as spots highlight. So that's why we wanted to include fMRIs. Let me pull up the slides as a backup myself. 1 second.
Okay.
Then
also on that last slide, we were mentioning like the neuroimaging. So I think that's really important. As I noted, it's full circle. We go back to the original slide where we're thinking about how much we've progressed in the field and research. And then really just like examining through fMRI, regular MRIs, brain scans, all of that is really just driving that. We need to look at more than just the individual that is using and the psychosocial factors. We have to really think about the brain and what is happening. Okay,
right.
So now, oh, go ahead, Juan.
No, go ahead. I was going to go into my strategy. I touched on it earlier. We talked about increasing self-awareness. Another one is replacement behavior. So when we talk about increased self-awareness, it's a little bit of psychoeducation in regards to knowing and being keen and attuned to your body as well as the state of your mind and how things, how you feel with certain things. So learning how to know the feelings of onsets of withdrawals or cravings, and knowing to not give into those cravings. It's instead you replace it with a productive or good behavior. A good example is like when a person's trying to quit smoking and they get a craving for a cigarette or nicotine, they chew a stick of gum instead. So other things is like when you get a craving to use, replace it with some sort of positive exercise, calling a friend, taking a walk, any type of behavior that will work on, much like Dr. Marr mentioned earlier, the brain's neuroplasticity, its ability to relearn, and you can retrain it. So instead of getting a craving, I need it, I take a hit, it's like, no, now I'm gonna do this instead, and your brain learns that new mechanism, and that's how you kind of work towards that.
Yeah, well, that's so awesome that you mentioned that. Again, that kind of talks about the self-awareness. So in order for individuals to really think about what do I do now, they have to become this self-awareness. They have to be aware of the moment, which also leads to making healthier decisions, right? So like what Juan said, but in order to get to that moment, they definitely have to have this moment of awareness and just self-reflection. So that's one thing. When I was in the field and I worked with clients, it was a constant just go, 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 not really stopping and pausing and saying, what is this feeling? Why am I craving this? What is this about? Instead, they would just automatically, because our brain works on habit, right? So this is what we're talking about, is really just rewiring the brain, which sounds so simple, but when you're craving and you're looking for something for that fix because of the addiction, it's often very hard for individuals to step back and look at that. So another strategy that rehab counselors talk about is the biopsychosocial model, which I touched on earlier, and positive psychology in general. And then Paul, if you want to share a little bit about what you do in your field, that would be awesome.
Sure. With all of this, I think it's important on increasing that self-awareness is providing opportunities for connection so that we're activating that limbic system, that mid part of the brain, so that we can acknowledge the emotional impact, but also the connection with others and connection with self, becoming more self-aware of what's going on in my body, what are the certain triggers that are happening around me environmentally, and being able to address those. And to do that effectively as therapists, as professionals working with individuals, we need to take a trauma-informed approach and implement trauma-informed practices. And also with that, research increasingly is showing that it's important to take an integrated approach. So not just psychological, but psychological with pharmacological, varying health professions coming together, working interdisciplinarily to be able to support and affect change with the individuals who may be struggling with addictions. So with that, I'm noticing our time, so I just want to give just a moment for some Q&A, and I'll show our reference slide as well while we're if there's any questions.